Staying with business news, one of the biggest medical aids in the country that looks after the health of government workers has issued a warning. The Government Employees Medical Scheme, or GEMS, says it will be on the lookout for any illegal manipulation of claims. It estimates that South Africa is losing 22 billion rand every year to fraud, waste and abuse in the healthcare sector. To find out more, we're joined by GEMS's Principal Officer, Dr. Stanley Moloabi. Thank you for being with us, Doctor. You've issued this warning saying now that people get back into the swing of things, visit more doctors and hospitals, there could be more abuse. Firstly, can we look back? We know that during the COVID-19 waves, many non-urgent but necessary procedures were postponed. Explain how health visits were affected then and what's happening now.
Good evening, Francis, and good evening to all the viewers. This warning comes just in the context of we know that we've been at level 1 since around October 2021, and at level 1 of the lockdown, activity is almost normal. So what we have noticed in our claims pattern is that there is a steady increase in certain categories of claims. And so we are just concerned about the fact that that increase, as naturally it should happen, because there was restricted movement for the past 2 years. But we would want to ensure that the increase is as a result of those claims that are genuine, where our members are seeking healthcare, access to healthcare, and it is not because of fraud. And that is really the context of what you mentioned as a warning.
Could there even be a lot of pent-up demand for some procedures, and that may be abused?
Well, we do know that elective procedures were minimized. As a result, there was people did not go to hospital, either because the hospitals were concentrating on dealing with COVID patients, so the focus was there. Also because people would have been avoiding going to health facilities for fear of catching COVID itself. So this increase in the claims could point to any of the fact that those that had delayed their elective procedures are now seeking access to that, which would be normal. But the concern is that we know that a proportion of some of those claims could be as a result of fraud, waste and abuse. So what we do is that using the systems that we have in place, we have to ensure that we pay for the claims that are genuine, but we also catch those that could be fraudulent.
All right, what are you looking out for in terms of fraud? What's the modus operandi of the fraudsters? And how bad does it get? Give me a worst case example, because you say that it's only a small percentage of providers that defraud the system, but they go big, and sometimes it can involve billions for everybody.
Yeah, so the syndicates, there are syndicates which commit fraud against medical aids, and that's the worst case scenario that you say. So syndicates would be, those who know how to claim from medical aids, do not render the services, and they willfully claim huge amounts, and it's usually not one establishment. So you could find that they have details of certain members, and they use certain practices, but they claim all over the country, and the effect of that is that the amounts that are claimed are generally very huge. So that would be the worst case scenario. Then you may have individual health care providers who may be committing fraud, and then the other category would be the collusion of those who are members who also defraud the scheme. And we must not forget that there's also the category of wastage, that's what we call fraud, waste and abuse. And the waste and abuse is a different category, which we could find that it's just overutilization, which is unnecessary of medical system. But the effect at the end of the day is still the same.
Would that be where a doctor recommends several tests that are unnecessary, and as a patient you're in a vulnerable position? You believe what the doctor says. Can patients look out for that?
Well, it is a very difficult area for patients. You have already mentioned that if you consult, you are vulnerable in that you don't have the technical know-how. So whatever the doctor says, and let's not only say doctors, let's say healthcare professional who orders whatever services, you don't have a say, because all you are thinking of, you want to get well. So that is overutilization, which falls into the category of waste and abuse. And then we could also have, for instance, you go to a health professional today and they give you a certain medication, you feel you're not okay, and then you go to the next one, but you don't tell them you consulted. You see several healthcare professionals for the same thing, and then you end up being prescribed several services which could be duplicating. That's also wastage, and that could be initiated from the members' perspective or for the patient perspective. So it's a myriad of combination of that could lead to fraud, waste and abuse.
Yeah, and you are saying to patients, don't go for treatment if you're not sick, which is a given, I guess. Finally, just on a general matter, you now have 760,000 or so beneficiaries, I understand. Government workers not getting raises in many instances. Does that affect you? Who has a choice to be a part of this scheme? Is it, or does government as the employer say you will be a part of this scheme, and prices may have to go up even if you're not getting a raise?
So yes, I think it's a very sensitive matter that affects us. So what happens is that the issue of raises, the raise that the employees of government will get is negotiated at the SABC, which is the Public Service Coordinating Bargaining Council. And the issue of what the contribution increase is on an annual basis does come into the focus, because it does affect the pockets of the public service employees. So, but we must also remember that the employer does subsidize GEMS very heavily. Public service employees, the majority, as you have said, about 760,000 belong mainly to GEMS, but there are others who are with other medical scheme, and the arrangements for the subsidy is different. GEMS, the subsidy is definitely the most favorable and the best that benefits the members, the public service employees.
All right, we'll leave it there. Thank you so much for that update. And yes, a warning to healthcare providers and patients as well. That was the Government Employees Medical Schemes Principal Officer, Dr. Stanley Moloabi.